Hello everyone, welcome you to another lecture in dermatology. So here we are going to see about Lichen Simplex Chronicus, Lichen Planus, and in addition to it my most important part, that is the differences between Pemphigus vulgaris, Bullous pemphigoid, Epidermolysis bullosa, and also a little bit about here and there about a few other conditions. What is Lichen Simplex Chronicus? Lichen Simplex Chronicus is basically a loop or a kind of disease. What do I mean by that? There is an initial itching. The initial itching can be due to any cause. It can be because of an atopy, it can be because of a dry skin or contact dermatitis, or anything can be the reason. So because of the itchy skin, because of the irresistible itch, the patient will scratch that area. So repeated scratching, the scratching initially will give a sense of relief, but it is not going to subside in that way. There will be repeated scratching and there will be repeated excoriations whereby the skin will become thick. That is what is known as lichen simplex, lichenified, that is thickened. It is another, it can be translated as. There is nothing much more severe to it. Therefore, it is simply known as lichen simplex chronicus. So, how do we treat the condition? The treatment is by breaking the itch cycle, and you should ask them to stop scratching or itching them. Thereby, and the primary pathology should also be treated, which is by moisturizing the dryness or whatever the pathology is which has caused to initial itching, that has to be treated. Let's see about erythema multiforme. What happens in erythema multiforme? This is an immune complex mediated reaction to any trigger. The trigger can be herpes simplex virus or mycoplasma pneumoniae or even medications such as sulfonamides. So because of these, the infection or the drug, a immune complex is formed and it gets deposited on the skin, and that formation is known as erythema multiforme. So the classic trigger is herpes simplex virus, that is HSV 1 or 2, and the other causes are also, it can be due to sulfonamides. The target lesions are pathognomic. So how do we come to the conclusion that it is because of immune complex reaction due to another reason? Because there will be additional features. Say for, let's say, the vignette, they will be giving you like a 23-year-old male who has painful vesicular lesions on the lip as well as fever, lymphadenopathy. So painful vesicular lesions on the lip with the fever and lymphadenopathy points towards herpes simplex virus. Along with it, there is a rash in the arm as shown, which is, there will be a central clearing which clearly points towards erythema multiforme. So how do we manage this? The primary pathology should be managed and the underlying cause should be treated, and the supportive care should be given with antihistamines. What is pemphigus vulgaris? In pemphigus vulgaris, there is autoantibodies against desmosomes. The desmosomes are those, that is the desmoproteins in desmosomes. But what is desmosomes? Desmosomes are those which will help to adhere the keratinocytes. So each keratinocyte will be adherent to each other by the desmosomes. When the antibody strikes the desmosomes, then the condition is pemphigus vulgaris. How will it be? Since the cells, the structure, that is the desmosomes which hold the cells together, is attacked by the antibodies, the cells that are present in the epidermis are not held together with each other. They are not attached with each other. Therefore, it can give way, resulting in blisters. So there is a positive Nikolsky sign. That is, when the pressure is applied over the skin gives way. That is, the epidermis shears off easily. Why? This is because the cells which is supposed to hold the cells together is attacked, and there is autoantibody mediated attack over there. Therefore, the Nikolsky sign will be positive. How will the immunofluorescence? Immunofluorescence confirms the diagnosis. It shows a net-like pattern. The treatment is immunosuppression with corticosteroids because it's an autoimmune disease. Rituximab is effective in severe. So we have another disease, that is the Bullous pemphigoid. What is the difference between pemphigus vulgaris as well as bullous pemphigoid? In bullous pemphigoid, it is also an autoimmune reaction where the autoantibody will target the hemidesmosomes. What is the role of hemidesmosomes? The role of hemidesmosomes is subepidermal, that is the basal epidermal layer, and it has to get attached to the basement membrane. So for the basal epidermal layer to get attached to the basement membrane, the hemidesmosomes are necessary. When that is attacked by the antibodies, then the disease is known as bullous pemphigoid. Here the important one is the oral involvement is rare. Secondly, the Nikolsky sign is negative. Why? Because the layer which is affected is much more deeper than the desmosomes. The desmosomes is present in the superficial layer. So when we give pressure on the skin, then there is a shear stress, that skin gives way. But in bullous pemphigoid, the hemidesmosomes are affected, which are much more deeper, and therefore when there is a pressure given, the deeper structure is there, therefore the deeper structure is affected, therefore the skin doesn't give way. So this is the difference, important difference in bullous pemphigoid, where the Nikolsky sign is negative. Immunofluorescence has different pattern. Pemphigus vulgaris there is net like, bullous pemphigoid there is a linear pattern. What about the severity? Pemphigus vulgaris is much more severe because it affects the oral lips, but bullous pemphigoid is less severe. A few more details about bullous pemphigoid. It targets the hemidesmosomes at the basement membrane. So since the subepidermal layer is affected, subepidermal blisters with eosinophilic infiltrate is there. There is a tense bulla, and pruritic, it has no oral involvement. Linear pattern on immunofluorescence. Since this is an autoimmune reaction, the topical and corticosteroids are the treatment of choice. Let's see in brief about Nikolsky sign. The Nikolsky sign is positive only in pemphigus vulgaris. What is Nikolsky sign? Epidermis shears off easily with the lateral pressure. It is caused by intraepidermal cleavage, which is a problem in pemphigus vulgaris. But in bullous pemphigoid, the cleavage point is much deeper, that is at the basement membrane, and therefore there is more stable epidermis. Therefore, the Nikolsky sign is negative. What is the clinical significance? This is the most important clinical significance. The positive and the negative Nikolsky sign helps to differentiate pemphigus and pemphigoid. Now we have the third condition, that is the epidermolysis bullosa. Epidermolysis bullosa is similar to pemphigus vulgaris and pemphigoid and bullous pemphigoid, but the only thing is it is not an autoantibody. It is not due to autoantibody. Here it is due to genetic. It is a genetic disease where there is mutations in keratin 5 and 14. The mutation in keratin 5 and 14 will affect the dermal epidermal junction. So as obvious, there is going to be skin blisters with minor trauma. Why? Because even with the minor trauma, the superficial layers are also not on a stable basement. Therefore, even with the minor trauma, there are skin blisters, hands and feet are affected. The disruption of the basal suprabasal cell interaction is disrupted. This is a pathophysiology, we know, but it is not antibody mediated. Here, how will the Nikolsky sign be? The Nikolsky sign will be negative because the pathology is much more deeper. Therefore, the skin will not give way with the shear stress. It is managed with wound care and infection prevention. Genetic counseling is also essential. What is Behçet's disease? Behçet's disease is something where there is oral ulcers, where there are genital ulcers, and there is high ESR. It is an autoimmune reaction with the ulcers. What is rosacea? Rosacea is a condition where there is painful facial erythema. It will worsen with spicy food, with alcohol, as well as cold weather. So facial erythema, it is not over the entire face, but it will be mostly affecting the nose. They will be having a plumpy nose which is painful and erythematous. So it is multivascular etiology, mostly vascular hyperreactivity, inflammatory response develops. The rhinophyma, that is a bullous enlarged nose, can also be seen in rosacea. Sometimes it is said that topical metronidazole is effective, but avoidance of the triggers such as alcohol, spicy food and cold weather is the most important treatment. These words generally confuses me, so I made a separate slide for it. What is roseola, what is pityriasis rosae, and what is rosacea, which we just saw now. Roseola is the one which is caused by human herpes virus 6, and they have a slapped cheek appearance which develops after fever. Pityriasis roseae has a typical herald patch and a Christmas tree distribution that may or may not be associated with HHV6. Rosacea is triggered by spicy food, alcohol and cold weather. It has facial redness and rhinophimoma. What about lupus perineo? Lupus perineo is a dermatological feature seen in sarcoidosis. Sarcoidosis, we generally have hilar lymphadenopathy on chest X-ray. How will lupus perineo present? They will be having a violaceous plaques on the nose, on the cheek, ears, etc. It is persistent and it may lead to scarring. The other features of sarcoidosis, such as non-caseating granuloma, is all present. And there is an elevated serum calcium, increased vitamin D production by the activated macrophages which are present in those granulomas. Perniosis. Perniosis is chilblain. The distal extremity, when it is exposed to cold air, the vasoconstriction happens. And when it is immersed immediately in a hot water, often due to a shower or a bath, the distal capillaries become inflamed. They become painful and itchy. Lesions develop. This is what leads to perniosis or chilblains. So the management is to avoid temperature extremes like total cold and total hot. So that has to be avoided. Topical steroids may be helpful. With related to perniosis, let me tell you about frost nip and frost bite. Nip is the word nip means that you're just taking a small bite. So this means that it is not very severe. There is a reversible cold exposure, but there is no permanent skin damage. In frost bite, it is because of severe cold injury. It can cause blistering and tissue necrosis. What do you know about aphthous ulcers? See, if you see here, this is aphthous ulcers. It is multifactorial. Either it can be because of stress, it can be because of food allergies, it can be because of trauma, it can be because of hormonal or nutritional. How do we treat the aphthous ulcers? Symptomatic treatment will do, and it gets resolved on its own. There is drug-induced neutropenia. Certain drugs will cause neutropenia, that is a deficiency of neutrophils. What are the drugs which causes a decrease of the neutrophils? They are particularly propylthiouracil and methimazole. So when it causes the neutrophils to decrease, it can result in mouth ulcers because of the decrease in the neutrophil, the mouth is more exposed to opportunistic pathogens, and therefore it may present with the mouth ulcers. So the vignette might give you like a patient who has been treated recently for hyperthyroidism after admission in the hospital now develops presence with a mouth ulcer. What are we supposed to do, or what is this? This is drug-induced neutropenia. One who is treated with hyperthyroidism may be treated. They could have been treated with propylthiouracil. So therefore, it can lead to agranulocytosis, leading to mouth ulcers. The best way to treat it is to stop the drug. So even when the patient is on hyperthyroid drugs such as propylthiouracil or methimazole, the blood count should be serially monitored, and we have to keep a watch for neutropenia. And when a neutropenia is detected, the drug has to be stopped. What is granuloma annulare? There is a ring-like pattern of small bumps on the hand. It is caused by cutaneous T cell response. It is a self-resolving condition. No treatment is necessary. What about lichen planus? In lichen planus, there are classical 4 P's: purple, pruritic, polygonal, papules. These are the 4 P's. What is the reason for lichen planus? The reason is still not very clear. It is thought to result from autoimmune reaction where there is a T cell response, or it can occur idiopathically. Sometimes it is seen in association with hepatitis C virus. It can be presenting on buccal mucosa, and it can be painful or asymptomatic. It will self-resolve, and if we treat symptomatically, it will do. The SLE, we have seen a lot about it, but what about the cutaneous manifestation? They can present with a malar rash, and they can also present with a discoid rash. Systemic features: SLE patients will generally present with polyarthritis. Because of the bone marrow involvement and because of peripheral destruction of the cells, thrombocytopenia can present, and sometimes the entire cell line can also be decreased. What is the diagnostic feature for SLE? Anti-Smith antibody is highly specific. Anti-nuclear antibody is positive in nearly all cases. Anti-dsDNA will indicate renal involvement. With this, we have come to the end of the presentation. I hope I have made certain things clear to you. If you like my videos and if you want to get mentored by me, I am a medical doctor. I am an anesthesiologist who has a passion for teaching. If you want to get mentored by me, you can write to me in the comments. I will be more than happy to guide you. Looking forward to see you succeed. Have a good day.